Hi, I'm Dr. Susan Furness, Discipline Lead for the Bachelor of Paramedic Practice with Honours program, which is a 4-year course designed to help individuals like you to become awesome paramedics. I've worked for Trobe University since 2009, but before that I practiced for many years as an intensive care paramedic with Ambulance Victoria and spent most of my career working in and with rural and regional communities. I responded to a wide variety of cases and provided education and support to both community members and other paramedicine staff. Now, while I'm still a registered paramedic, my focus is on ensuring that students get the education and experience they need to really excel in a career that I personally found very rewarding. Now, I guess most people gain their understanding of what paramedics do from seeing an ambulance at the scene of an accident or from watching one of those paramedic TV shows. One of the things that the paramedicine team here at Trobe really understand well is what paramedics can be expected to undertake during everyday practice. It isn't all about lights and sirens and flash and dash. You won't be saving someone's life every single day of your career. You may not even have to deal with blood or trauma every day either. You'll actually be doing so much more because paramedicine is about helping people when they need it most at a variety of different ways. On any given day, you might be called on to help someone with a medical condition or a chronic disease, or educate someone about their health, provide management and support to those with mental health conditions, or save someone's life, or even assist a mother to deliver a baby. And that's the really exciting thing about what paramedics do. You never know what you might be called on to do next, and you never know when that may be. So, how do we best prepare someone for such a diverse and important career? We've carefully designed our paramedicine program to ensure that students graduate not just as paramedics with contemporary skills, but paramedics who are ready for what the profession may be like in the future. Ours is a 4-year program, which really helps us to deliver just the right level of depth and complexity needed to create exemplary paramedics. You'll learn about things such as anatomy and physiology and pathophysiology. You'll learn the clinical management of a variety of conditions, and that includes pharmacological management or drug interventions needed for a particular condition. Then there's obstetrics, gerontology, paediatrics, care of patients with special needs, marginalised population health, major incident management, the list goes on. We believe that high-level communication skills and emotional intelligence are essential to paramedic practice, so they also form a large part of the course as well. You'll also be studying law and ethics, public health and research. They're really important to what we do as paramedics. You'll even have a choice in the latter part of the program as to whether we focus on the research honours stream, where you get to undertake an exciting paramedic-specific study, or the industry stream, where you learn extended paramedic skills, including ultrasound, intubation and wound suturing, alongside advanced clinical reasoning and extended care practices. The subjects are set up in a number of ways throughout the course. For example, some subjects are delivered via a blended learning model, and that includes distance or online education. In other subjects, such as those that involve clinical skills development, you'll be undertaking theory components, but you'll also be coming into our practical labs, and that's where we are right now. Our facilities are designed with the specific needs of paramedicine students in mind. We have a simulated residence space with a layout just like a small apartment, complete with kitchen and bathroom. We have cameras and microphones installed in the room so we can record simulations and play them back for you as a form of feedback. Now, most of our work will take place in the prac lab that I'm in right now, where you'll find a variety of actual medical equipment, the same as currently used by paramedics across Australia and overseas. And then there's the patients, or really the simulated patients, as they aren't real, but they can do a variety of things like breathe and cough and talk and yell. They've got blood pressures and lung sounds, and you can insert needles and other medical equipment into them. Here's one of our mannequins being worked on now by a couple of our paramedicine students. Hi Harry, what are you doing?
Hi Susan, I'm just prepping up a saline flush for the IV that I've just popped into this patient.
Great. And Sheldon?
I'm providing airway support via an LMA and a bag valve mask.
Right. What have you enjoyed most about this course so far?
I love how we can gauge our knowledge by the practical skills that we learn. So the things that we learn online in our classes or in our lectures, we can then come into the prac lab and practice them.
And Harry, what have you enjoyed most about the course so far?
I think what I've enjoyed most about the course is the fact that you have a really small class size. This means you get one-on-one feedback from your teachers quite frequently, and it's almost instantaneous feedback from your assessors and the people who are teaching you. I think this has improved my practice greatly.
Thanks Harry and Sheldon. You've provided us with some really good reasons to come and study at Trobe, but I'd like to mention a few more. We have small class sizes, so that means we get to know who you are as an individual, and we can take more of a personalised approach to your education. You'll also get to know your peers better. which will have a really positive effect, not just on your learning, but on your well-being as a whole. You'll have more hands-on equipment time, and we have a greater ability to offer you something a little bit different, such as major incident exercises and other in-field simulations. We have a specialist team of experts. Your paramedic academics each have varied and extensive experience in paramedicine. Other facilitators are experts in their own fields, such as pharmacology and public health, and they bring that knowledge to you in exciting and interesting ways. Now, we generally do things a little bit differently to other university paramedicine courses. We believe in delivering a comprehensive program that really speaks to the breadth and complexity of the discipline. And we're future-focused, delivering contemporary practices and offering you opportunities to start on the road to specialisation in paramedicine. We also offer a variety of different clinical placement opportunities, including emergency and non-emergency ambulance service, mental health, aged care, hospital and emergency department, and primary care centre placements, all designed to help you in understanding and practising within the healthcare environment. And finally, how will you know if this course is for you? Do you have what it takes to be a paramedic? What qualities should you have? Well, a desire to help people is really important, as well as a desire to do well. This isn't an easy course, and being a paramedic isn't an easy career, but that makes it all the more rewarding. Now, you can come into a course where you can sit back and not participate. You can come into a course where you sit back and not do anything, but this course is not for you if that's what you want. This is about inspiring you to do your best. You need to have strong communication skills, but we help you with that. You need to have problem-solving skills, but we help you to develop that. We help you with all of those things. You just need an awesome desire to be a fantastic paramedic in the most interesting and satisfying career that there is. We can certainly help you with that.
Hi, my name's Sheldon Burke. I'm a third-year paramedicine student at La Trobe, Bendigo. I chose La Trobe because I've heard a lot of really good things about it at our career nights. I also wanted to stay in Bendigo because I'm a local boy. I wanted to enjoy local things like my footy and that sort of stuff. And I heard really great things about the paramedicine course, and I really wanted to set a high standard for myself and choose to go to something that's not quite so easy.
Hi, my name's Harry Morrill. I'm in my final year of paramedicine at La Trobe University in Bendigo. Throughout my degree, I have been working for Ambulance Victoria as a community officer. This has provided me with hands-on experience throughout the entire course whilst I'm not already on placement. I think that this has given me a lot more opportunities in terms of being able to work for Ambulance Victoria, but also it's broadened my horizons and made me want to start looking interstate and potentially work for other different services. My favourite placement opportunity was probably a placement that I got in Broadmeadows in Melbourne. The reason it was my favourite is I got a very different experience to what I'm usually used to working in rural Victoria. It meant that I got to see a range of different medical cases, and on my final day I was able to deliver a baby.